I treat patients from pretty much any age, adolescent all the way through geriatrics. So anybody that has primarily knee joint, elbow joint, shoulder joint, hip joint, or any musculoskeletal issue within that time frame. I do shoulder replacements as well, and a lot of ligament reconstructions. So I got into orthopedics because it's a very biomechanical field. There's nothing more fun than trying to figure out what is bothering someone, confirming that, and helping them get back to doing the things that they love. Individualizing the care is incredibly important. Oftentimes people have the same pathology, but maybe it affects their life differently, or you might treat a ligamentous injury in a 55-year-old different than you would a 20-year-old college athlete. The care has to center upon the patient's goals and how to get them back at a functional level that they desire to. So that's where the solutions can differ despite having the same pathology. And when you see someone that you facilitated through that process and they got better and they appreciate all of that, there's nothing more rewarding than that.